I was earlier discussing with you that if the muscle is in grade 3 retraction, that means the muscle is cut, and over a period of time, the muscle shrinks and goes back. That's called grade 3 retraction. In those kind of scenario, you can't easily repair it back, like the way I showed in the earlier video. So here, we have to do additional procedures. So one is something called as SCR. So you can watch my SCR video to understand that. So ACL I don't do in my practice anymore now because I don't think it is required. But I do an advanced surgery called as a muscle slide. So I'm going to show you about the muscle slide. So what is muscle slide? So this is your ball socket joint, and now you can see the muscle has gone back like this. This is the muscle. It's supposed to be fixed here, but the muscle goes back like that. So this is grade 3 retraction. So imagine if I'm operating and trying to pull this, it will not come back to its spot. So what do we do? You should know that all these rotator cuff muscles, this is my back of my shoulder. So this is a bone called as the scapula. This rotator cuff comes from the scapula. So this muscle called as the supraspinatus, which is the upper muscle, comes from this area called the supraspinatus fossa, which is basically this area. So this is the supraspinatus. You can see that it is coming like that. You can see it is coming like this. So we opened this area, that is the upper back. So if this is the patient's scapula, and if this is the area which I'm showing, I have to open this area slightly, 2 centimeter incision. And you open this and then you see the muscle. Then you have to release this muscle. You have to release this muscle off the bone like this. So you release it like this, like this, like this. When you release it, the muscle becomes loose inside, the attachment becomes loose. So then it will be much freer for me to catch it and bring it back in position. Then similarly, if this muscle over here is called as the infraspinatus, this one, this comes and attaches like this. This is the infraspinatus. You can see it like this. Actually, they have not shown this complete muscle. This brown thing should come all the way here. So what do we do? I open this area and I release it like this. Slide it. So this is called as a muscle advancement or a muscle slide surgery. So what happens? It becomes very easy. The muscle becomes loose with attachment. I should be able to catch it and bring it back to position like that. This muscle as well as this muscle. Bring it back to its position. So that's how we do it. So if you do this particular technique, any muscle which is retracted becomes repairable. So and this is the muscle advancement surgery or a muscle slide surgery. Thank you.